Welcome to this meeting of our Roundtable on Environmental Health Sciences, Research and Medicine, and the second day of our workshop on the interplay between environmental exposures and obesity. It's a great pleasure to have all of you with us here today, whether here in person at Research Triangle Park or online on the webinar that we're holding for this meeting. This is, as you know, a meeting of what's called a roundtable by the Institute of Medicine. Roundtables and forums at the Institute of Medicine and the National Academies broadly operate for the purpose of hosting discussions and conversations about important scientific issues, bringing people together to be able to elucidate new directions that they might want to, where we might want to move forward, but they do not produce consensus reports, and in fact this meeting will not result in any one set of recommendations about how to move forward on this particular issue. That being said, this meeting will culminate in the production of a report that will reflect the presentations that have been given yesterday and today. I should also say that the very outstanding presentations that we heard yesterday, as well as the ones that we are expecting to hear today, will be available on the website for the roundtable and can be viewed if you didn't have a chance to hear the presentations yesterday. If you didn't have a chance to participate in the webinar, you can go back and review those, and in fact they will be available for quite some time. And I think it's going to be a marvelous resource for this community. On my side, as the Roundtable Vice Chair, my name is Lynn Goldman, for those of you on the web audience. And I'm a professor and dean of public health at the Milken Institute School of Public Health at the George Washington University, and the vice chair of this roundtable. And I will also be moderating the next session. So with that being said, in the way of a welcome, I wanted to move us into the first session of the day. The day will be divided into 3 sessions. We're going to learn first about nutrients, food additives, and antibiotics, and then we're going to have a session on research needs, a final session on policy solutions, and the meeting will adjourn today at about 4 p.m. Just to and so moving into session 4. We have 4 speakers, 2 of whom are going to join us by phone, and each speaker will have 20 to 25 minutes to present, followed by 5 minutes of clarifying questions. After the presentations, there will be a 50-minute discussion period. It would be helpful for speakers to note any relevant financial conflicts of interest at the start of their presentations. And we do have Kathleen Stratton in the front row, who will be here to help the speakers keep track of their remaining time. Obviously, those on the phone, we will also ask you to adhere to the time limits so that we have enough time for the discussion at the end, which is a very important part of this. So I'm going to just introduce all 4 of our speakers, and then we'll go through them one at a time. The first speaker, Nick Durantar, is professor and chair of the Department of Nutritional Sciences at Texas Tech University. He is president of the Obesity Society for 2014 through 15 and an editor of the International Journal of Obesity. A physician and nutritional biochemist, he has been involved with obesity treatment and research for over 20 years, and he coined the term infectobesity, obesity of the infectious origin. Our second speaker, who's also joining us by phone, is Charles Bailey, a member of the Divisions of Oncology and Hematology at Children's Hospital of Philadelphia, and assistant professor of clinical pediatrics at the University of Pennsylvania. His focus is on leukemia and lymphoma, and particularly on acute lymphoblastic leukemia, the most common kind of childhood cancer. Dr. Bailey serves as the lead investigator for the Data Coordinating Center of PEDSNet, a collaborative across pediatric academic centers to provide a standardized model for clinical care. Our third speaker, Aisha Erkin Kakmuk, currently works at the University of California, San Francisco as a clinical research associate with Dr. Robert Lustig on a study investigating the effects of sugar reduction in diet on metabolic health among obese children. Previously, she worked as a visiting physician and clinical researcher in the Pediatric Endocrinology Division at the Yale New Haven Hospital. Our fourth and final speaker is Christina Rother, a clinical investigator in the Diabetes Endocrinology and Obesity branch at the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK. Her research is focused on islet cell transplantation, islet regeneration, and beta cell preservation in pediatric and adult patients with type 1 diabetes. Most recently, her research interests have included pediatric type 2 diabetes, how bariatric surgery works to resolve type 2 diabetes in adults, and the metabolic effects of artificial sweeteners. So without further ado, I would like to invite Nick Durandar to join us by phone. And we do have your slides up before us, Nick.